Hi everyone, Aaron Brooks here. Today I'd like to talk about knee pain. A lot of times with knee pain, the knee itself isn't really the problem area. Quite often the dysfunction or the underlying problem or cause is really coming from the hip joint, pelvis, or the foot. So for example, let's say that what I'm saying is it's coming from the hip. If we were to look at the bone here, this is your femur bone, and this is actually your hip itself where the femur comes in and meets the pelvis. If your hip was turned inward, so on myself, if my leg's turning in, so my knee's kind of pointing this way, but my foot's straight ahead, if you look at that, you're going to get really a torquing in the knee joint itself. So anytime a person, if they were in that situation, they were to put load into their foot, more times than not, that hip is going to rotate even further in, which is going to put a lot more stress on the inside of the knee or within the knee joint itself. So that would be an example of the knee issues really stemming from the hip. If it were stemming from the foot, for example, if you look at the foot, if the foot's pronating, which is a pretty common term, but if it's basically rotating inward or collapsing inward, well, that's going to also put stress on the knee. So typically a person will compensate for those types of dysfunctions. And the most common one is a person will typically toe out with their foot. So with the toeing out, though, the problem with that is it actually causes even more pronation at the foot and the ankle, which is then going to put even more strain on your knee. Now, if it was coming from your pelvis, this gets a little more complicated, but it could be the pelvis could be affecting the hip affecting the knee, and the knee down to the foot, and vice versa, foot all the way up to the pelvis. So with the pelvis, it could be a twist this way, where the pelvic twist or rotation is actually putting more stress on the inside of the knee. Or if the pelvis was elevated, so let's say that the right side was elevated, it would be causing the person to load harder on that particular side. Or thirdly, it could be actually an asymmetry in the tilt in the pelvis. Now, when you start looking at the pelvic tilt, without getting too complicated, as the pelvic tilts this way, it's going to directly affect the rotation of the hip, which is going to directly affect the position of the knee. So those are the most common reasons that we find at Perfect Postures why you experience knee pain.